Hi everybody, this is Dr. Jamie Marich, and today we're going to be working with Ujjayi breathing. I know that sounds like a bit of a weird name. It is a Sanskrit word. The best translation would be something like ocean sounding victory breath. However, the pop culture nerd that I am has always loved the kind of alternate nickname, which is Darth Vader breath. One of the first times I learned this breath in a yoga class, the teacher used that descriptor, and it really resonated with me. This idea that the breath should really have some volume going with it, that deep respirator type of quality, if you will. So, what I'm going to do with this breath is first kind of demonstrate it, and then we're going to go down and break down the technique of how to do it and explain some of the value in this breath in terms of having it in your coping skill collection. So where this breath is a little different than others you may have learned from therapists is it's not really in through your nose, out through your mouth. For this breath to be working at its fullest technique, you want to be thinking of in through the nose, out through the nose. In through the nose, out through the nose. And at first, when you're learning this breath, you want to think of keeping the inhales and the exhales nice and even. In the video on count variation, I'm going to be giving some instruction on when you may consider lengthening exhales, when you may consider lengthening inhales. But for now, just think of nice, even inhale, exhale. Doing the work with your nose. So let's not worry about the sound just yet. Let's try about 3 or 4 of them together with just using that nose-nose technique. So in through the nose, out through the nose. In through the nose, out through the nose. In through the nose, out through the nose, in through the nose, and out through the nose. So just with that first basic, go ahead and check in with it, noticing whatever it is you may notice about that experience. So now I'm going to go through some suggestions on getting a little more sound, getting a little more of the fullness of that breath. Now, I have heard 4 or 5 different yoga teachers teach me this 4 or 5 different ways. So I'm going to give you some different ideas for how to really get the sound going. Because ideally what you want to think of is allowing the back of your throat to contract. One of the easiest ways to think of doing that is if you're fogging up a mirror. So go ahead and just try that. And really feel the motion that's going on in your throat with that. Some people get into the technique of this, of really making sure that the tongue is in a certain position. I have never found much difference with the tongue in terms of the sound, although if you find that letting the tongue raise to the roof of your mouth helps you get more sound going, or letting it sink into the base of your mouth helps you get more sound moving. Whatever you have to do variation wise with your tongue, go ahead and do that. I've always found the focus on the throat really being what's most imperative in getting the sound going. So another thing you can think of doing is slightly puckering the mouth as you do it, so the mouth is still closed. But for a lot of people, that slight mouth pucker does help with the contraction of the throat. So if you have to do a couple sets in through the nose, out through the mouth, to really help you concentrate on the throat contraction, at first you can do that. I would invite you eventually to be able to move it to where the mouth is more or less sealed off, unless that's triggering or threatening for you. But you really do want to think of this breath of the nose doing the work. Of course, the breath is originating from the belly breath, which is why I recommend from the diaphragm area, which is why I recommend that you've at least tried that breath first on this series before going into this. So let's try a few together. In through the nose, out through the out through the nose. I tripped up a little bit there because if you need to go out through the mouth at first, you can in order to really get this technique. So let's try it in through the nose, out through the nose. In through the nose, out through the nose, in through the nose, out through the nose, in through the nose, out through the nose. So let's just release that breath, checking in here, especially if you're not used to it. I find that pushing too many of these too quickly can possibly lead to some uncomfortable lightheadedness. So just check in and notice what you're feeling. And if you are feeling a little bit of that tingly lightheadedness, that good lightheadedness, that actually is very normal with this breath, and it's one of the ways that you can really use this breath to help you promote a natural sense of relaxation. One of the reasons I encourage use of this breath is it is one of the best breaths for getting you out of a freeze response. It more directly stimulates the lower levels of the brain than any of the other breaths we're doing, and it can help you get out of that freeze response. So especially if you know that that's an area of vulnerability for you, if you know that you're going to be walking into a high stress situation, I typically advise a preemptive use of about 3 or 4 of these breaths. So if this technique is still a little foreign to you, go back, watch this video again. I find that this breath requires some practice, especially if you're not used to it. So if this is something that's totally weird for you and you didn't get it this first set during the video, just keep practicing it. It will come a little more naturally. Here's one little variation tip. I want you to be mindful of this breath. Think of that kind of huff and puff response we get into when we're angry or we're exacerbated or we're triggered or exasperated. I'm sorry. What we're really doing with this breath is just slowing that down. So this is a very natural response to get, especially when we're in that high stress mode. So think here, something you're angry about. Take a nice deep inhale with your nose, belly expands. You can make that angry face if that's helpful. And then let it all go. Exhale with the nose. So for some people, thinking of that helps you actually get the ball rolling with this breath. And then hopefully over the next 3-4 breaths, you notice that the angry response on the face does tend to loosen a little bit. But really that's all we're doing with this breath is taking that natural, I'm going to huff and puff and blow your house down response and just slowing it down for a little bit more of a relaxation, a little bit more of a therapeutic benefit. This is Dr. Jamie Marich. Thank you for joining me today. Be well.